New videos every day.
Hi, I'm Roddy Iglesias. I'm a certified clinical nutritionist.
And I'm Peter McCarthy, a certified traditional naturopath.
And this is Wake Up America.
Imagine, if you will, that it's the year 2017. You're going to the store to buy something that costs $5. But when you walk in, you realize you only have $4. That's the situation we're going to find ourselves in if nothing changes. By the year 2017, $1 out of every 5 will be spent on healthcare in the United States.
Peter, when we say healthcare, which is obviously, it's a huge issue right now in the political arena, healthcare, are we really talking about healthcare? Aren't we really talking about disease management?
Absolutely, Roddy. We're talking about a disease management system, and there's some very important information that proves that conclusively. First of all, 25% of a person's lifetime healthcare expenditures occur in the last year of their lives. Secondly, a survey that was done in the state of Ohio that looked at how much time was spent in educating patients about wellness versus treating their disease symptoms found that the sicker the person got, the more time was spent on disease and the less time was spent on preventive care.
Yeah, and isn't this really the medical paradigm today? It's a real misnomer. Remember the movie Sicko?
Oh, absolutely.
Yeah. Okay, I wrote an article, and it was from sicko to wellness, or wello, from sicko to wello. And the important key that I was pointing out is while all of the political figures today are bantering around who's going to pay for their quote-unquote health care, what they're really talking about is who is going to pay for their drugs, their surgery, their geriatric care, their medications, their prescriptions, right? That's what they're talking about.
Absolutely. And when you look at the fact that almost no time is spent on preventive care when talking to a healthcare practitioner, it really explains why we're in the situation we're in. For example, when you look at the Bureau of Vital Statistics data for the year 2006, out of the 10 leading causes of death, 8 of them are diet and lifestyle related. What are we doing about that in our healthcare system right now? The honest answer is not much.
And even in that study, and the study that I read too, the other causes of death in this country were homicides, suicides, and accidents. And we can trace back that lack of proper nutrients, et cetera, skews judgment, et cetera. And so, the old Twinkie defense and other things that actually were legitimate reasons that you can trace back to our being nutrient deficient and being toxic exposed and stress induced, right? You're coming out with the new book called Stress Inc., which we've been doing a teleconference on. And, you talk a lot about the stress condition and what this country and what this world is in. And our medical paradigm is not looking at this. They are simply looking at diagnosing a disease. In other words, once the horse is already out of the barn, then what do we do with it? And they're not looking, as you say, in preventative, and they're not looking in wellness at all.
Absolutely. And therein lies the problem with our healthcare system today. If in order for us to really make a dent in what's going on in healthcare, we've got to look at those root causes of why people do get sick and start, as you put it very well, looking to keep the horse in the barn before all of that occurs. That's not happening today. And we're going to be talking over these next several weeks with you about several aspects of this, why this occurs, but probably more important, what we all can do about it, and we can do something about it.
You know, there's another thing that I think what you and I have discussed as far as this program. What we're doing and the reason why we're calling it Wake Up America is because there's so much in the media today that is spewing out basically what big corporation wants you to hear. And Peter and I are here, and we will be here in the next few weeks doing episode after episode of very hard edge, very cutting edge kinds of stuff that they are not going to tell you in the media. Things like advocacy science or the influence of money in scientific research or corporate influence on our nation's food supply. What else?
Media hypnosis, the effect of all of that on the reporting of health issues in the mainstream media. Medical education in nutrition. Is there any? I think you'll be surprised at the answer. And we'll go on to look at some of the politically oriented issues that surround health and healthcare in this country, because we believe people really do need to be informed in an unbiased and balanced way about what is out there in the way of reliable information and what they can do as individual citizens to change this.
So guys, really what we're also looking for is your comments. We want your feedback. We want this to be your opportunity to have interaction with practitioners that can get down to the root of the real research, bring it back to you, bring your questions forth in comments. Make sure that you sign on to this to Psyche Truth. Make sure that you also go to our website, which is the TexasHealthFreedom.com. You can read all about what's going on in Texas. If you're not from Texas, still go on to the TexasHealthFreedom.com and see where your state might be able to glean some information for what's going on in the political arena in your state. What else do we want to tell them?
Only that this is information that is critical to you, critical to your families. It's information that we hope that when you see it, you're going to find that it's important enough to get it out to your families, your circles of influence, and around the country. Because if we all work together to take action, we can make a difference.
So when you turn this video off, get to your comments. Ask us what you want to hear. What do you want to hear on the other side? Not what Good Morning America is telling you or what CNN News is telling you about your health care, but what you really want to know. What's behind the scenes of the corporate cloak? What's behind the scenes of the medical education or lack of, or the Dietitians Association. We're here to answer your questions, and we're here to interact with you. So make sure that you make those comments and stay tuned for the next Wake Up America.
Thank you, folks.
There are over 350 videos on our channel, and I doubt you've seen them all. And the topics range from weight loss, nutrition, sexual health, all the way to psychology and mind control, and anywhere in between. And I think if you check them out, you're going to find some really interesting stuff.